As we were looking around, we were looking for somebody that does the upper cervical, and Dr. Hilpisch is one of the few in the Twin Cities that does it.
I had a neck where I couldn't turn it. I could only do this or this, and all my friends knew that. And so after I started coming to Dr. Hilpisch's office, why, pretty soon I could start turning my neck, and lo and behold, look at me, I can move.
Hello, my name is Dr. John Hilpisch. I'm an upper cervical chiropractor. We use what's called the Blair technique. What I'd like to do is walk you through what you might expect as a new patient coming into our office. The first thing we do is have you fill out a full health history. We're concerned about your entire health here, not just the pain, but how's your entire system functioning? Are your glands working properly? Are your muscles working properly? Are your energy levels as high? Are you productive at work? Are you sleeping well? These are all things that are tied into your nervous system. When we first meet our new patients here at Hilpisch Upper Cervical Chiropractic, we will have them fill out a complete health history. This health history is designed to not only look at the muscles and the joints of the spine, but also we're going to do a full systems check. When the nervous system encounters interference, there's no way that the brain and the body communicate properly. That means the body is unhealthy in some part. After we look at the history, we will do a chiropractic and neurologic examination. One of the easiest, simplest screens that we have to tell if the upper neck is out of position is to actually look at the level of the feet. When the neck is off, the head will tilt. If the head tilts, the brain doesn't like that. It'll try to keep your eyes level at the horizon. By doing that, it'll bring one shoulder up, the opposite hip pulls up, and we have a complete structural imbalance throughout the entire spine. By looking at the heels, we'll typically see that one heel is higher than the other one. From as little as 1/4 of an inch, I've seen some of my patients walk in off the street where they've been close to 2.5 inches off. Not because they have a short leg, but because the muscles of the pelvis are not getting the proper message from the brain. Another valuable tool we use in evaluating the nervous system is the infrared scanner. The scanner picks up subtle and obvious changes in the body's physiology, and it tells us when the spine is out of alignment or when the body's adapting properly and making corrections. Our patients do not need to be adjusted on every visit.
And so I came to Dr. Hilpisch, and it's kind of funny to think about now, but I didn't even consider that my headaches could possibly be helped with chiropractic. I just thought I had to live with headaches for the rest of my life. And that was the biggest surprise that I've had in coming here for chiropractic adjustments is my headaches are gone. I haven't had a headache for 4 months, which is remarkable. I was having almost daily headaches and full-blown migraines a couple times a month at least. And my trigeminal pain has been gone for 6 months. I'm off of all my medication. I have absolutely no symptoms of anything right now. So it's been remarkable.
And my father had told me about Dr. Hilpisch, who does upper cervical, and that's what we were looking for because that's what we grew up with my grandfather. When I was younger, I had a wandering eye, and doctors had said, I need surgery. My grandfather said, she's not going to get surgery. We can correct it with upper cervical, so it was corrected.
After we've determined then that the upper cervical spine is irritated, there's a subluxation in the upper part of the neck, we will then go in and take what are called the Blair x-rays. The Blair x-rays are designed specifically to take into consideration that God forms every spine differently. There's asymmetry built into the upper part of the neck. It's a very, very common spot to have one side of the spine formed and shaped a little different than the other part. The Blair technique will work with that asymmetry. The base posterior film is taken from underneath the jaw, and it gives us a beautiful picture of the atlas bone.
What really surprises me is I don't think I've been adjusted since November, and that's about 4 months. I can't believe I haven't had to have an adjustment since then, but I feel better. I'm off of my medicine. I haven't had any asthma symptoms.
I'll take great care in analyzing the films. These films will tell us exactly where your problem is, exactly how it needs to be corrected. No two people have the exact same misalignment. No two people have the exact same anatomy. It's the only x-ray system in the world that visualizes the misalignment at the joint surface.
And our children started getting upper cervical from the moment they were born, and my children have not had any problems. Being pregnant and having chiropractic care, it helped. I feel my 9 months of being pregnant, it was a lot easier. My deliveries went fast. I just think everything was maximized health-wise with the upper cervical.
Using the angles and the misalignment that we determined off of the special Blair protractor x-rays, we can then make the perfect adjustment for each patient. We will take the patient, lay them on a special side posture table. It's a very safe adjustment because we work with the angles that God has given that particular patient. Each person has their special adjustment based on their angles. So no two people in the world get the exact same adjustment. That's what's so special about the Blair technique. Most patients, when they get their first adjustment, wonder, is that it? Because it's such a soft, low force adjustment. That top bone in your neck starts to move, opening up more space for the brainstem. The brainstem then can send the messages out to the organs, into the glands, and into the muscles. The healing starts immediately. Once the adjustment is given, we find that it's very, very important that we don't ask those muscles to do more than just work on the adjustment. So we bring them into a very special room we call the resting room. In the resting room, the patient is asked to just lay there calmly, peacefully, as that adjustment starts. Before they even get off the table, quite often we'll hear comments about a flow of energy that they haven't felt in years. It's not uncommon for the Blair adjustment to hold and work for a week, 2 weeks, 3 weeks. Some patients can hold an adjustment for a month. We have patients that hold adjustments for years. We have some patients in our office that have been holding adjustments for over 5 years. One adjustment, putting the body back into alignment, allowing the nervous system to express itself, allowing full health to be met, full health potentials to be met.
I have referred many people to Dr. Hilpisch's office, and especially the ones with back pain, lower back pain, hips, legs, and they are absolutely amazed that he works on just the upper two cervical. So I found out what upper cervical meant, and I understand that now. So they have just been absolutely amazed.
Patients don't get adjusted as often. Patients respond faster. They have better performance at the job. They have better performance in the gym. They have more energy. They have an ease in their body that they haven't experienced in years. This all from a little correction in the upper part of the neck.
My oldest, he was adjusted right away, and we have had no earaches with him. He has not been on any antibiotics, and he is now 6 years old.
I was a general chiropractor for the first 9 years in practice. We helped a lot of people. The limits that I saw is that we were able to help people on a more temporary basis. Although the patient would walk out of my office feeling pretty good, they were typically back in my office a week later or 2 weeks later with the same problem. We never saw any permanent type corrections. With the Blair technique, I've seen a complete turnaround in my practice. What we're able to do is put the healing and ultimately the rehabilitation of the nervous system and the spine back in the hands of the brain. The brain is the best doctor for your body. If we can understand that upper neck, make the perfect adjustment, keep the pressure off the brainstem, the brain remembers exactly where things should be. It will allow the lower neck and the middle neck, the lower back and the pelvis to realign itself. The brain wants the spine to be in the right alignment.
And then our daughter, Rachel, was Down syndrome and hearing impaired, and she started coming here, and she's off of her monthly medications for
Her hormonal medication, she's completely off and doing fine with her cycle. She was on what is basically a birth control pill for mood swings during her cycles, and severe mood swings, and she's really leveled out. She's had a history of behavioral issues, and really she's very even keeled right now. Behaviorally and emotionally, she's just absolutely delightful. She's a lot of fun.
If you're interested in finding out what the Blair technique can do for you and upper cervical can do for you and your family, please give us a call. We'd be happy to sit down, go through a health history with you, do your exam, see if chiropractic can help you.